Hello, this is Erik Dalton at the Freedom from Pain Institute, and I would like to personally welcome you to my Dynamic Lower Body e-course. We've arranged this program in 6 sections in order to make it simple for you to navigate through the videos, technique descriptions, and the multiple choice exam. These are the 6 sections we're going to cover. Let's begin with gait assessments. So as a client enters your office, before undressing, start looking for slump postural patterns such as upper and lower cross syndromes, in other words, sway back, forward head postures, etc. Also observe for right motor dominant torsional patterns, such as one shoulder dropping toward the contralateral hip. And as they walk, do you see a smooth cross-pattern gait or the limbs not moving in sync? Pay particular attention to arm swing. Number 2, in the standing and forward bending assessments, we'll begin by palpating and springing the client's arches, checking for overpronation problems and fixated joints in the feet. Then we observe the knees. Are they bearing more weight on the inside as seen in valgus knock-kneed people, or is one or both bowed laterally? See if you can tell if the asymmetry in the knees is coming from the hips and pelvis and compensating down, or from the feet and compensating up. Once you feel you've developed a general idea of lower body compensatory patterns, then move up to the lumbar spine and palpate for excessive or reduced lumbar curve and unnecessary spinal rigidity, as seen in protective muscle guarding. Observe what happens as a forward bend and side bend. Do you see asymmetry in the low back or thoracic spine indicating a possible functional or structural scoliotic pattern? In the supine table assessment section, number 3, we begin by measuring the client's leg length and then move up to the hips and pelvis, checking bony landmarks such as the ASIS and greater trochanters, and check for movement restrictions. For example, when assessing for SI joint movement restrictions, you'll want to use the ilium rocking test. This simple assessment really gives you a bunch of valuable information about pelvic alignment problems and is also a great provocation test for sacroiliac joint dysfunction. Remember, if there's a posterior hip pain during this test, make note of it, because we'll be addressing SI joint and low back pain later in Section 5. Now, for Section 4, let's move on and look at supine treatment, where we begin by addressing common problems of the feet and lower leg, such as plantar fasciitis, ankle sprains, and shin splints. Then we move up and start to correct pain and dysfunction in the knees, hips, and sacroiliac joints. Once all the lower body corrections are completed, we move on to assessing and correcting problems with the client in the prone position. So in Section 5, we'll again begin at the feet, ankles, and lower leg, picking up on the treatment we've already started in the supine position. This prone position is really effective for conditions such as plantar fasciitis and lower leg pain. We move on up to the knees, and we start to look again at the knees and see what kind of movement dysfunctions they may have. And don't forget, when you get to the knees, to start to balance out the hamstring muscles that may be pulling unevenly on the client's knees, causing asymmetry and or pain. Then when we move up to mobilizing the femoroacetabular hip joints and stretching the quads and iliopsoas muscles, it's really important that we don't create too much lumbar curve as we raise the client's leg and hip into extension. That can really irritate those with facet joint syndrome and intervertebral disc problems. So once you get some movement in the hip joints, move on up and get to work on the hip external rotators, particularly piriformis, for those that may be presenting with sciatica and or low back pain. Finally, in Section 6, the sideline position, we again move back down to the ankles and lower legs, making sure we've relieved any protective muscle guarding related to old ankle injuries and shin splints and things like that. We move on up to the inner thigh, And our goal there is to stimulate tone in the client's pelvic floor while working the adductors, adductor muscles. We'll be addressing such things as chronic groin injuries and or femoral nerve entrapment syndromes. So in those clients that are having trouble with low back pain and were unable to side bend to one side, we need to address quadratus lumborum muscle contractures. And this is one of my favorite techniques for dealing with problems in this area. So we finish off the dynamic lower body course by assessing and treating sacral torsions, low back spasm, and thoracic spine rigidity. Just remember that all the test questions are taken from the technique copy. We're primarily interested in verifying that you've read all the information we deem most important. Some of you may wish to follow along with a partner while you view each of these videos and come back later and take the exam. Just remember, there is no time limit on completion of this dynamic lower body program. You can submit your test and receive your 32 CE state and nationally approved credits anytime you wish. Thank you, and I hope you enjoy this course.